Hey, welcome everybody. Dr. Jason Dean, drjasondean.com. It's your source for health, freedom, and knowledge. I hope you're having a great Wednesday. It's off to a good start, and today got me thinking. A couple weeks ago, I had one of the more amazing, straightforward, in-your-face cases, successes, testimonials you'll probably ever see or hear. We'll get to that in 1 second. If you are looking for information, education, more info, knowledge on whether it's parasites or infections, detox, the things that we talk about here all the time, you can grab my very free, 100% free Parasite workshop. You can watch anytime for good. All you have to do is go to the website, parasiteworkshop.com. It's really simple, parasiteworkshop.com. Go check that out. So I had a couple come to me almost 2 months ago now. And when the couple came in, they had moved from out of the state into Florida, and he's a pastor. They lead a local church, and he came in off of a referral from somebody else to see me. Now, he came in, and they take care of themselves in general, okay? In general, takes really good care of themselves. Him personally, which I'll get to the wife on a different video, he runs, he works out, he gets sunlight, vitamin D, etc. Takes, in general, very good care of himself, okay? Now, here's the kicker. He came in, and he immediately took my MVX test. MVX test stands for Metabolic Vulnerability Index test. I take that blood test on almost everybody that comes to me now, okay? If you'd like yours, you just go to drjasondean.com and you click the red button at the top that says MVX test, or directly to drjasondean.com/MVX, Metabolic Vulnerability Index test, okay? Now, what happened was he came in and he was put on a statin medication. Now, it is my opinion these statin medications are some of the most dangerous medications on the market. My question to you, how many of you are on a statin? How many of your spouses are on a statin medication? Why do they give you statins? To lower your cholesterol. Here's the big problem. You require cholesterol for normal human physiology. Your body requires cholesterol. And there's so many reasons why. Your brain is made of cholesterol and fats. You must have cholesterol for your brain to work, right? Your heart requires cholesterol. Your liver requires cholesterol. Your hormones require cholesterol. Now, here's the basic fact on cholesterol, and there's tons of them which I'll go over as we do more videos. Every single cell that you have in your body is made up of probably trillions of cells. All of your cells, like the border of your cells, what surrounds it, and what protects the inside, that cell wall is made partially of cholesterol. If you don't have cholesterol, you will not have cell walls. Now, this gentleman was on a statin medication because his doctor, his medical doctor, wanted his cholesterol lowered. Now, when he came in, his cholesterol was at a 133. I was like blown out. Like 133, is he out of his mind? 133? I told him, I go, your brain isn't going to work anymore. Now with that, muscle weakness, fatigue, potential wasting also can come with statin use. This gentleman works out. This gentleman runs. He was starting to experience weakness and pain in his, you can't see it now, but his thigh muscle, his quad up front, for no reason. He didn't know why he had it. He's like, my legs hurt. So he likes to work out. He likes to eat well. He likes to take care of himself and run. And his legs were hurting. The muscles of his legs were hurting. And I said, dude, you can't have 130/30 cholesterol. He said, well, what should it be? I go, I want your ideal. Now, this is my training. I have learned from the likes of many practitioners out there. I have learned from great dentists out there as well. Okay, Dr. Hal Huggins, who I consider one of the great geniuses of dentistry, he's passed away. He did well over 10,000 blood labs on all markers, right? And he found the healthiest people were at 222 total cholesterol. Okay, we'll go into the other numbers later because I want to focus on this case. 222 being a great middle cholesterol line. The gentleman I was working with was on a statin and he was down to 133 and going lower. I said, whoa. I'm not taking you off a statin. I don't have a prescription license to do that, nor do I want one. I ran the MVX test on him, which you all can get. I ran that test, and then I told him and educated him on parasites. I educated him on Lyme, co-infections, bacterias, funguses, viral, and everything. And I said, I bet you have parasites. I bet you have infections. I bet you have some toxins in there. Then I started him on what I call my MVX protocol, which you all can get access to if you go to drjcd.com/MVX. You sign up, or you go to drjcd.com and the MVX red button. You can click on that. You can get a consult with me. I will find out. Do you need that? Do you need deeper cleaning? What do you need? So my follow-up with him, here's the crazy part. So about 3 weeks ago, he came back, right? After a month on my protocol, he said, it's unbelievable. I go, what happened? He goes, I feel better. He goes, I've lost weight. And he hasn't changed anything other than going on my protocol and doing what I asked him to do. He already was eating better. His muscle pain and his fatigue of muscles and soreness of muscles disappeared. He no longer needs the statin. He went off the statin, not because I told him to, I did not. He went off of it. Then he says, you wouldn't believe what happened to my cholesterol. He pulls his phone open because he also did a complete blood count and a cholesterol number. His cholesterol, with detoxification, starting the remove parasites, I haven't even gone into hardcore parasite stuff with him. He went from a 133 total cholesterol to 185 total cholesterol in 1 month on my stuff. It's unbelievable. But not even the number. His muscle pain and fatigue disappeared. He no longer has a problem running, working out, exercising, anything. Cardio, fine. He feels stronger. He has more stamina, right? Amazing. He goes, I can't believe. He was so blown up. He goes, I cannot believe. He goes, what are the doctors doing? Michelle, you can either go to drjcd.com and click on the red button MVX test, or you can go to drjcd.com/MVX. It's M as in metabolic, V, vulnerability, X is index, okay? He was like, why aren't doctors talking about this? He's like, why aren't more doctors doing that's what he had. He goes, what? Him and his wife both. Why aren't more doctors doing what you're doing? And I said, great question. I wish I fully understood. Here's the thing, everybody. And, you know, I have a family history, not me. No, I don't have it, but my family has heart problems, right? My grandmother passed away from her third heart attack, right? My mom had a minor heart surgery when she was like 7 years old, right? Cardiovascular disease is the number one still in America. It beats cancer, it beats diabetes, it beats neurological diseases, it beats everything, right? People want to know, why are their arteries plaquing up? Why do they have clogged arteries? Folks, when your cholesterol becomes a problem, if it goes way too high or it goes way too low, it's part of your immune system. You must have cholesterol. The cholesterol is not causing your plaquing. Toxins cause plaquing. Microplastics cause plaquing. There's science on that. Parasites cause plaquing. I've talked about roundworms. You know, we're having this big mosquito, tick, that whole problem in America right now. When you're bitten by a mosquito, when you're bitten by a tick, spider, etc., anything that bites, right? The insects. We're coming into summer. They're gonna be all over the place. When you're bitten, they actually inject parasites, Lyme, other bacterias, viruses, fungus, you name it. It is proven that they inject parasite larvae in of roundworms. Those roundworms go into your cardiovascular system. They grow. They literally swim around your system on top of all the microscopic parasites and bacteria. Those proven, even the vets prove this. The vets tell you. They go in and they die in your cardiovascular system and they become clots. Those clots then fall, they go into the bloodstream, they can potentially cause strokes. That's from the Veterinarian Association. Don't you think that also happens? There, it's back. Hopefully it's still working. If you didn't hear me, it disconnected for a little bit. If you did hear me, great. Anyway, when you have cholesterol issues, you're dealing with infections, everybody. That's what's happening, okay? Yes, we're going into the summer. You're going to have a lot more of the insect problem, 100%. That's obviously a huge thing in the news. I get it, right? However, let's be realistic. Cardiovascular disease is still number one. It's by and far, and with my family having problems with cardiovascular system, it's really kind of close to my heart and that I want to help you, right? Like I helped this gentleman. I'm going to go into his wife's story maybe later this week or next week. His wife has another whole story about how her weight loss. 1 month, everybody, 1 month. His cholesterol started normalizing, started going back to where it's supposed to go. And he felt tremendously better. And his cholesterol went from 133. They were going to destroy his brain, everybody. When the statin takes hold, and I'm going to do another whole video on statins because it is amazing. This patient told me, he said, why are doctors still doing these statins if we know that they don't work? And I said, that is a great question. The science has already been out on statins, and yet they still prescribe statins every single day. And your cholesterol, they're lowering your cholesterol, which means they're lowering your immune system. It is scientifically proven. There's papers written on it. You can go back and look at my old shows on Rumble. That the cholesterol, LDLs specifically, the LDLs they told you were bad for you, they actually destroy, they cut. It's called lyse, L-Y-S-E, and it's a medical term. They cut and destroy parasites. Your cholesterol. They don't want you to know that your cholesterol is part of your immune system. And I know many of you are out there battling what you consider bad cholesterol. I know your spouses, the husbands out there, battling this problem with statins and cholesterol. If this gentleman down to 133 and we brought him back to 185 in 1 month, 1 month. That does not happen in the medical system. Doctors don't reverse things like that, okay? Huge, huge information. Remember, plaquing comes from toxins. Plaquing comes from plastics. It comes from parasites, bacteria, etc. When the immune system in your cholesterol is not allowed to fight, when the statins lower your cholesterol and your cholesterol is not allowed to fight anymore, you will continue to have these major problems. The plaquing will build up, and that leads to cardiovascular disease, stroke, heart attack, death. Unfortunately, not me saying, that's in the science, right? You have to go after the infections. You have to go after the parasites that live in the bloodstream and are taking over because they are lowering your immune system. So remember, ideal cholesterol 222. That's from the scientific greats. I have all their information. But let's help you. I find out, do you just need a full moon protocol? Do you need my MVX protocol? Do you need deeper personal work, which I do that as well? How much do you need? We find out. That is my job for you, is to find out what you need, and let's help reverse your case like I did with this gentleman. 1 month. 1 month from having his brain and his muscles destroyed by statins to reversing him to where he is going back to 200 cholesterol, off the statins, his brain works, losing weight, better stamina, his muscles work again. I know a lot of you are dealing with restless leg syndrome and muscles issues out there, lack of magnesium, sure, but the cholesterol is getting messed up. You have to handle the parasites, the bacteria, the infections, the toxins, etc. If you want to go right for it and grab it, and you want to work directly with me and find out, do you need a full moon protocol? Do you need the MVX protocol? Do you need deeper work? You can go to drjasondean.com/MVX. I'll put the comments as well in here on Facebook, as well as when it goes up on Substack, YouTube, Rumble, etc. Or you can go to drjasondean.com, and there's a red button that says MVX Test. Click on that, jump in, and we will actually help you do that, okay? Somebody's on Crestor. Yeah, we have supplements to actually help with that plaquing. I'm going to be careful how I say that. I've watched plaquing disappear and reverse. All right? Please save this video. I'll save it the best I can. Facebook gets rid of it after 30 days. That's them, not me. If you wanted more information, again, go get that MVX consult. Also, if you want the Parasite Workshop and get more data on this, go for my free Parasite Workshop at parasiteworkshop.com. And as always, my Parasite Bible is out there, parasitebible.com. More information coming on this, more help for all of you. Let me know how I can best help you today. I'm Dr. Jason Dean. I want you to have a great rest of your Wednesday. As always, love, serve, and help. We have a lot of people to clean up. We have a lot of people to get their health back. Have a wonderful day. We'll talk to you soon. I'll see you tomorrow, everybody. Bye-bye.